Now, I have to tell you, it's an unbelievably complex subject. Nobody knew that health care could be so complicated. And statutorily and for budget purposes, as you know, we have to do health care before we do the tax cut. The tax cut is going to be major. It's going to be simple. And the whole tax plan is wonderful. But I can't do it until we do health care, because we have to know what the health care is going to cost. And statutorily, that's the way it is. So for those people that say, oh, gee, I wish we could do, the tax first, it just doesn't work that way. I would like to do that first. It's actually, tax cutting has never been that easy, but it's a tiny little ant compared to what we're talking about with Obamacare. And you have to remember, and I say this to Democrats in the room, of which we have many, Obamacare has failed. If you go to Minnesota, where they had a 66% increase, and the governor of Minnesota, who's with us today, said Obamacare, the Affordable Care Act, is no longer affordable, something to that effect. I think that might be it exactly. But the Affordable Care Act is no longer affordable. Obamacare has failed. I say to the Republicans, if you really want to do politically something good, don't do anything. Sit back for a period of 2 years, because 17 is going to be a disaster for Obamacare if we don't do something. Let it be a disaster, because we can blame that on the Dems that are in our room, and we can blame that on the Democrats and President Obama. Let it implode, and then let it implode in 18 even worse. Don't do anything. And they will come begging for us to do something. But that's not the fair thing to do for the people. Not the fair thing. Politically, I think it would be a great solution. Because as soon as we touch it, if we do the most minute thing, just a tiny little change, what's going to happen? They're going to say, it's the Republicans' problem. That's the way it is. But we have to do what's right, because Obamacare is a failed disaster.